Weiner. Let's bring in a colleague of yours from the House side, Republican Representative Bill Cassidy of Louisiana, and he is also a medical doctor. Dr. Cassidy, let me play for you and the senator, if you can, a video from 2003 when Barack Obama was running for the United States Senate. Let's play the tape and then get your opinion.
A single-payer healthcare plan, universal healthcare plan. That's what I'd like to see. But as all of you know, we may not get there immediately.
So, Senator, the president himself, there was a time when he was in favor of single payer, and as Anthony Weiner and others are saying, you can't have single payer with a private health insurance company, any private health insurance company. So do you think this is actually what the president wants, Congressman?
Barney Frank was the one that said on his way into the bathroom, if you will, you can see it on YouTube, I thought you were for a single payer. Why are you supporting the public option? And Mr. Frank said, as he opened the door, he said, I am, but properly done, a public option leads to a single payer. So I think that's clearly their transparent agenda. On the other hand, I obviously think it's the wrong agenda.
Well, we actually have the full direct quote of Barney Frank, if we can put that up. I think this is from Barney Frank, July 30, 2009. I think that if we can get a good public option, it could lead to single payer, and that is the best way to reach single payer. So, Congressman, if in fact you have somebody who's in favor of single payer, like Congressman Frank is saying that the public option is a good way to lead to that, should we all be wary of the public option if we don't want single payer?
Absolutely. And the reason that we're wary of both that and the single payer is because neither controls cost. Right now, we basically have a single payer system for folks over 65. And although Medicare does a good job for those folks over 65, the program's going bankrupt in 7 years. If the main focus of health care reform is cost, because if we don't control cost, we can't provide quality health care for all, then out of the control cost ruins that. Single payer will not control cost.
Well, Senator Crapo, what happens now? Are the single payers, have they been totally marginalized by the opposition that we saw from the general public over the summer, or do they still have a shot at this?
Well, I think if they put a direct, immediate single-payer proposal out on the floor in either the House or the Senate, it would be defeated today. But you have to remember what the agenda is and what Barney Frank said as he acknowledged it. They believe that if they can get a government option out there, in other words, the establishment of a government insurance company, that will create the infrastructure and pave the way to move to a single-payer system, and they may have the votes to do that. One point I think that needs to really be driven home here is not only has the president acknowledged that this is the objective and many others, but those who have analyzed the proposals that we are now looking at, the so-called government option proposals, have indicated that the natural result of them over a relatively short period of time will be to drive people out of the private sector markets and into the government option to the point where everything topples and moves to a single-payer system.
Dr. Cassidy, I'm just wondering if the single payers have thought about the process by which we move the private sector workers over to the public sector. I mean, there's going to have to be a whole series. First of all, you fire about 500,000 people. Then you have to retrain people to work within a new public sector entity that's got to be created. There have to be buildings that are going to be built in Washington. I mean, have people really thought through the whole process by which this is going to be done?
David, I think they probably have. The irony of this is that the public option actually is not that radical. It does not replace a top-down bureaucratic controlled process. It just nationalizes what currently is private and therefore can be regulated and makes it public, which the government is both the referee and the player. But really, it's not radical. It is still a top-down, bureaucratic-centered approach. It's not a patient-empowered approach, which is what Republicans favor, and frankly, a patient-empowered approach is the only thing that's going to control cost.
So, but let me just make sure I understand. So it would be more like what happened at GM or Fannie and Freddie. That is, they just changed the nameplate in front of the store from private sector to public sector?
Well, I think it would be much like Medicare is now, which is a very successful program for the elderly in terms of meeting their needs, but it's incredibly expensive and it's going bankrupt in 7 years. It currently needs rescuing. The kind of funny thing about this is we're patterning this after Medicare and expanding Medicaid, 2 programs going bankrupt, and we expect the 3rd program to rescue the first 2. I think we'll enter into a cycle where there'll be more and more public dollars going to support these 3 entitlements, sucking money away from every other priority in government.
Well, Senator, let me go back to the senator on this, because we have word coming out in the past couple of days about attempts to pull some antitrust forgiveness that a lot of the insurance companies have away from them, maybe as a first step to making them more vulnerable for takeover. How's that going, and what's the rationale behind that?
Well, decades ago, there was a limited antitrust exemption provided to health insurance companies that has facilitated the private sector, frankly, as we've moved forward. And interestingly, once the health insurance industry pointed out the facts about what these plans that are being brought to us here in Congress would do to the cost of health care, then all of a sudden, I think rather punitive efforts were undertaken to say that, well, okay, if you're going to not support our health care plan, we're going to take away your antitrust exemption and start punishing you. The bottom line is that this is just one more effort to try to take a shot at the private sector, make it a little less workable, and at the same time send a message to others in other industries like doctors and other healthcare providers that if you step up and let the public know what's really going to happen with these healthcare plans, you're going to face some retaliation as well.
All right, Senator Crapo and Congressman Dr. Cassidy, good to see you both. Thanks for being here. Appreciate it.
Thank you, David.
Now, here to score the legal side.